Hi, I'm Jonathan Goodman, and today I'll be presenting our paper, Signaling and Rich Trustworthiness in Data-Driven Healthcare, an Interdisciplinary Approach. This is submission number 0156. Briefly, I'll take you through what we're calling the Trustworthiness Recognition Problem. Then I'll discuss how appealing to models from ecology, economics, and evolution can help to provide a solution to this problem. And lastly, I'll give an overview of the applications of our solution, specifically in the area of data sharing and AI. So first, the Trustworthiness Recognition Problem. So first, a bit of background. In the last several years, there have been a number of global surveys that have aimed to evaluate public trust in data sharing. Previous work has shown, for example, that people place trust differently by group. So for example, many people trust their own doctor more than for-profit companies. Moreover, people who are more trusting of a greater number of institutions appear to be more likely to donate their data for research. We previously conducted a study at Imperial College where we evaluated in a qualitative way what the public's hopes and fears were around data sharing. People were most worried about their data being exploited for private gain and about their data introducing bias and increasing inequalities. These fears have real impact. As of 2022, for example, more than 3 million people have opted out of health data sharing. It's been repeatedly argued, however, that rather than focusing on gaining trust, people and institutions involved in research should focus on being trustworthy. Baroness O'Neill wrote in 2018 that trust is valuable when placed in trustworthy agents and activities, but damaging or costly when misplaced in untrustworthy agents and activities. So it is puzzling that so much contemporary work on trust, such as that based on polling evidence, studies generic attitudes of trust in types of agent, institution, or activity in complete abstraction from any account of trustworthiness. We believe this relates to what we're calling the Trustworthiness Recognition Problem, which basically focuses on how untrustworthy institutions can mimic trustworthy ones so that no matter what a trustworthy institution says, an untrustworthy one can appear the same way. This leads to the public being unable to decide in whom to best place their trust. So how does appealing to evolutionary theory help us to overcome this problem? Let's take a step back and discuss small societies. Previous work by anthropologists has shown that ancestral humans tended to live in groups of about 150 people, corresponding to a prediction by the human science researcher Robin Dunbar. What's important about this is that in these societies, everyone could know one another personally. In large stratified societies, characterized by complex institutions, however, this obviously is impossible. So we need a cognitive shortcut in the absence of information about another person to determine whether we are going to trust them. A huge amount of research in anthropology, psychology, economics, and philosophy has been devoted to understanding how a cognitive shortcut towards trust might work. Much of this, over the last half-decade, has focused on the prisoner's dilemma. And for those who aren't familiar, in the prisoner's dilemma, two individuals who are partnered can choose to cooperate or defect in a given situation on one another. And importantly, cooperation leads to a small mutual benefit, defection leads to no benefit for either, but when one party cooperates and the other defects, the cooperator gets a negative payoff, whereas the defector gets a huge payoff. Work has repeatedly shown over the last 50 years that when you run a prisoner's dilemma, either in a computerized setting or with humans in an experimental setting, you find that if they are only going to interact once, the best strategy is always to defect, because you will always be better off than if you risk cooperation with someone who might betray you. However, when the odds of meeting the same person again go up, it starts to make more sense to cooperate. Because if you know you're going to see the same person over and over and over again, your payoff over time will be better if both of you cooperate to work together rather than always to defect on one another or try to lure the other into cooperation when you defect. This links with the idea that trust reduces cognitive load. If you don't have direct information about a person, you appeal to other information when deciding whether to enter into a trusting partnership with them. This information will be highly contextual and often unconscious, but has been a critical part of our evolutionary development. Trust is therefore an integral element to any society where you can't know everyone personally, though faking it, that is, falsifying the signals that drive trust, remains a problem. Here we can appeal to something known as the costly signaling hypothesis in evolution and economics. The idea behind this is basically that in order to have a real signal, something that people use to drive decisions that they make, it needs to be costly. It must be very difficult to fake, or else the signal will have no meaning. There are hundreds of examples of this process across the ecology, evolution, and economics literature. Importantly, though, they all focus on the idea that there is an internal quality that individuals are trying to demonstrate to the outside world. One example used in anthropology is around hunting. It is difficult to fake being a good hunter because the proof is in what you bring home. Today, the situation is much more complicated because we are dealing not only with other people, but with institutions. To account for this, all societies have developed mechanisms for creating signals upon which people rely when making decisions in everyday life. For example, food hygiene ratings are objective, impartial measures about whether a restaurant has sufficiently high hygiene practices. This leads to individuals needing to trust only one institution, in this case, the Food Standards Agency, rather than in every restaurant they visit. It may be possible to fake the signal, but it is difficult and very costly if the faker is caught. How does this apply in the context of health data sharing? What's needed is a way of determining, and importantly, advertising, whether institutions have paid the costs of being trustworthy and being recognized as trustworthy in the context of health data sharing. Let's talk a little bit about how we might do that. First, we need to show that the institutions and people who handle health data are doing so in a way that accords with the public's needs. One example is transparency. Surveys have shown that the public wants to understand how their data are used. This may be one element of paying the costs of demonstrating trustworthiness. We believe that a game theoretical scenario, coupled with targeted qualitative research, can help to clarify, and we hope, to prove this case. If, for example, transparency is a signal associated with trustworthiness, one possible practical route is to follow models from scientific publishing to ensure transparency. This could include openness about relationships with industry, clarity about approved researchers and the approval process, publication of all financial gains made from data sharing, and enforcing full conflict disclosures in a digestible format. More broadly, however, if successful, a well-qualified notion of costs in the context of health data sharing will bridge trustworthiness to trust, overcoming the trustworthiness recognition problem. And finally, we believe that our game theoretical model that relies on costly signaling has applications beyond the area of health data sharing, from vaccine hesitancy to adherence around public health guidance. For now, we are currently planning a broad, interdisciplinary project in the context of health data and welcome any ideas from attendees of this conference. Thanks so much for listening.